Hi, everybody. Thank you for joining us today. We'll get started in just a couple of minutes. In the meantime, we would love to know who's joining us today and where you're joining us from. I don't know what. Alrighty, good morning, everyone. We will go ahead and get started. My name is Lincoln Till. I'm the Senior Assistant Director for Orientation in the College Programming and Orientation Office. Thank you again for joining us for another segment of our summer webinar series. Today's webinar will be all about student wellness and the services and opportunities available to you as UChicago students. The majority of the webinar will be presented by our student wellness colleagues, and then at the end of their presentation, we will have a time for some Q&A. So please submit your questions in the little question and answer box at the bottom of your screens. We will try our best to answer as many as we possibly can. Some of them we will just answer in the chat right there, and some of them we will ask out loud at the end. And yeah, with that, I will now go ahead and pass it on over to Elizabeth Webb, Director of Health Promotion in Student Wellness.
Thank you so much. Thanks everyone for being with us today. We're super excited to chat with you a little bit more about UChicago student wellness. We will do our best to answer all of your questions, provide just a general overview of student wellness. And if you have any questions at the end, obviously, please feel free to ask. So as mentioned, my name is Elizabeth Webb. I'm the Director of Health Promotion. I am here with my lovely colleagues. I will pass it over to let them introduce themselves. Karina, would you like to start?
Technology, I'm sorry. Hi, my name is Dr. Karina Bauer. I'm a psychologist at Student Wellness, and I'm also in the role of Associate Director of Clinical Services. And then I'm going to pass it to Celia to introduce herself.
Thanks, Karina. Hi, I'm Celia Bergman. I'm Program Manager at Student Wellness, and one of the programs that I manage is student insurance. So looking forward to chatting with you, and I'll pass it on to Andrea.
Hi, everybody. My name is Andrea Magana. I'm a quality management nurse supervisor. I'm also a registered nurse, and I do a bunch of stuff here in the Student Wellness Center right now.
All right, thank you. So as mentioned, we will be chatting about all areas of student wellness today, but as a student at UChicago, you have access to coordinated and comprehensive medical, mental health, and health promotion services. So we'll talk about each of these areas today, how you can access us, what type of services we offer, and what is needed to get started. So basically, we just want to let you know that we are here to support you. We're here to support you throughout your entire time at UChicago. That means when you're feeling great, when you're feeling not so great. If you're feeling great, we want to see you for our prevention programs and other services. When you're not feeling great, you can always make an appointment with us. We are really here to provide additional support to you throughout your entire journey at UChicago. If you scan the QR code on the bottom of this slide, you can learn a little bit more about services offered at Student Wellness. And just as an FYI, all of our services are offered at no cost for eligible students. So once you walk in through our doors, you will not be paying for the services that you receive at Student Wellness. We are located just almost a block off the main quad. So as you can see on this slide where the blue star is, that is where Student Wellness is located. We're at 840 East 59th Street. We are open Monday through Friday, 8 to 5. And we're generally open during breaks as well. So we're here over the summer, we're here during spring break, during winter break. We have occasional closures on holidays, but you can always check our website and our calendar for closure days. But we are here most of the time. To access any medical, mental health, or health promotion services, you can always just give us a call. Our number is on the screen. And if you scan the QR code at the bottom of this slide, it will actually download our contact card and save it in your phone. So a really good idea to do that. I'll give you a second to do that before I move forward. All right, hopefully everyone got that, but we can always come back. Everything that you need for student wellness services, appointments, asking questions to your provider can be found in the wellness portal. This is where you also upload your immunization records. You can see your test results in here. And you can access this portal again by scanning the QR code and inputting your CNET ID, your password, and your date of birth. And then once you're logged in, you can personalize your profile. So you can update your preferred name and your pronouns. Then we'll know, how you want to be addressed. So please go in, log into your wellness portal as soon as possible. Everyone who is a registered student should have access to that already. And tell me if I'm wrong, Celia, but I believe you can already upload your immunization record. So please do that as well. All right, I'm going to pass it over to Andrea to talk about our medical services. Oh, Andrea, you're muted. Sorry.
Thank you, Elizabeth. Thank you very much. So here in the Student Wellness Center Medical Services, our mission and our goal is to provide high quality, accessible student care. Again, most of our services that we provide here, well, all of our services we provide here are free of charge, as long as you have are participating in a qualified program. Most of our lab work here is also free. If there's lab work that needs to be charged, you will be having that conversation with your provider as to what lab work that is. We're here to support the student holistically, academic success through health, wellness, and also mental health care. We also do have preventative care here, health education. We are one of our goals is to create an inclusive and respectful and welcoming environment here on campus. Next. There we go. This is a little bit of an overview of medical services that we have here for our students. Preventative care and primary care, annual wellness visits, AKA annual physical, and evaluation and treatment of acute illnesses such as like colds and flus. Oops, 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 oops. Oh, should I hurry up? Um, we get a lot of like insect stings in the summer, a lot of like scooter injuries, those sorts of things. You can always, call and schedule an appointment for any of those. Also, you can also call and speak to a nurse, get some triaging going. Women's and reproductive health services, gyne care, PEP and PrEP, STI testing, that sorts of things. Contraception we have here, also emergency contraception, immunizations. We help people helping with the immunization compliance, management of chronic conditions. If you have high blood pressure or, kidney issues, that sort of thing, we help get those referrals out to specialty providers. Lab services we have here, point of care testing. If you're traveling abroad, we have travel medicine consultations, um, rapid flu COVID testing, wellness counseling. We have sports medicine doc here. We have pediatricians here. We have providers who specialize in eating concerns, prescription refills. We do all kinds of stuff, allergy injections, that sort of stuff. Okay. We are not a walk-in clinic, and I highly stress that. However, if you have an issue and you want to speak to a nurse, in regards to that issue, you're not sure if you need an appointment or not, you can always pop in, ask to speak to a nurse, and we can kind of take it from there. Our nurse navigators will triage the situation. If it's just home care that you need, we'll give you those sorts of tips and advice. If they think it's an appointment, if it's an appointment need, then we'll help you get scheduled an appointment. If it's more urgent than that, then we'll get you off to the right facility, either ER, urgent care, those sorts of things. Appointments are by appointment only. You can go through the portal to make an appointment. However, if you don't see what you want, it doesn't fit your schedules, you can always give us a call. Sometimes we're able to kind of move things around in the schedule to accommodate a student. That's our goal, is to get care to our student who is in need of an appointment. So again, if you don't see an appointment that fits your schedule, give us a call at the 773-834-9355 number, and ask to speak to one of the nurse navigators, and we can try and get you in, that's something that fits your schedule a little bit more better. We do offer in-person visits, and we have lots of telemedicine visits as well. Okay. Urgent and after hours medical assistance. Um, you know, Sometimes accidents happen, illnesses happen, and it's not 8 to 5. You can always call our nurse advice line and at the number that's on the screen. Or you can also speak to one of our actual on-call providers. It's actual provider that works here in the clinic by calling the number on the screen. Um, Again, if it's a life-threatening emergency, please call 911 or go directly to the emergency room. If you don't feel like it's a quite uh, an emergency, or you're not feeling it really well, there's also a couple of urgent cares that are around campus. One of them is on 53rd and Kimbark. That's the Midwest Express one. And then Northwestern Medicine, we also send a lot of students there to their urgent care. It's on 48th and Cottage Grove, which is not far from the Wellness Center. And I'll turn it over to Celia.
All right. Thanks, Andrea. So, upon enrollment at the university, Illinois law, as well as the university policy, requires that all incoming students show proof of vaccination. And most students have to show proof of vaccination for diphtheria, tetanus, pertussis, measles, mumps, rubella, and then also meningococcal, and that's for students who are under 22 at the time of matriculation. So what does this mean for you? Your specific vaccine requirements depend on your program of study. For example, medical school students have different requirements. So to see your personalized list, just go into your wellness portal and go to the medical clearances section. And there you will complete the tasks that are listed as your action items. You may submit your immunization records now. Again, that's through the wellness portal. And we do encourage you to submit them before you come to campus, but at the latest, you need to submit by October 2nd. That's the first Friday of the quarter. And please note that students who do not submit proof of immunity by October 2nd, we are required to restrict you from registering for future quarters. That's what the Illinois law requires. So please do your best to get those immunization records in ASAP. And there's a QR code here on the screen that you can use to learn more about the immunization requirement. Lots of details. Again, students coming in for autumn quarter, your absolute deadline is October 2nd, but please try to get it in sooner than that. And I will turn it over to Karina.
Okay, so I will talk about our mental health services. As you could see there, that's a picture of our mental health services staff. It's made up of therapists, case managers, psychiatric staff, and then we also have a clinical training program. As you can see, we have an incredibly diverse staff. Our staff speaks several languages, Mandarin, Spanish, other languages, really competent, diverse, friendly staff. And just want you all to know, an eligible student accessing our mental health services, our services are completely confidential and no cost to students. And why would you maybe seek our services? Really, we say any reason. There's no struggle you're having that's too small or too big to come see us. If you're having a hard time at any point in your academic career, please make an appointment with us. We have a really great, competent, friendly staff who will help you navigate whatever you're going through. Here's a list of some of the common things. I'd say the biggest thing we see is anxiety, sometimes loneliness for students, but really any reason you're having a hard time, you're more than encouraged to come see us. And how do you come see us? Every student, the first contact you'd have with us is through an initial consultation. And really, that's just a 30-minute appointment, confidential appointment with one of our therapists. It's virtual, but it can be in person if you need, especially if you're a first year who has a roommate and you kind of don't know how to navigate getting privacy. Just let us know you want to come in person. That's absolutely okay. A student can make that first appointment by calling us, the number's down there, or you can go onto the wellness portal and web book it. And you can do so that way you can see all of our profiles, our bios, find a time that works great for you. And we have those web bookable appointments available 5 days out. I will say fall is our busy time, but we really try to have appointments available within a week for students. And collaborative care plan. So at Mental Health Services, we offer a ton of services. The main thing students come see us is for individual therapy, sometimes couples therapy. We do provide short-term treatment. And really, essentially, kind of if you go down case management, if a student knows maybe something they're struggling with would maybe be better suited for long-term therapy, or maybe they need kind of a specialized treatment, we have case managers and our staff will help a student connect to somebody in the community so they can have ongoing services. But our services also include psychiatric med management. So say a student knows like they've been on a medication in high school and are coming here, they'd want to come in for an initial consult and we'll connect them to psychiatry to continue with that service. Or if you're here and you're looking to explore that for the first time, we'll also help you connect to that. We also offer group therapy. That's, I think, something exciting that we offer here. I think it's such a great opportunity for students to be in a group, to try group therapy. I feel like university is kind of the most robust area that happens. I'd say I've been doing this for, oh my gosh, close to 20 years, and I've been doing group therapy. And my favorite thing is when a student says like, oh, I couldn't wait for this session because I had to tell you all something and I knew you would understand. I think it's such a great place for students to kind of work on issues, get support, and feel really connected and close to kind of peers. But I will say that usually we kind of put that on the website closer to the fall quarter. And we offer kind of long-term groups, like process therapy groups. We offer kind of short-term education groups, like skill-based groups on anxiety or emotional regulation. Obviously, that's my interest area, so I'm going to stop myself. But that's all on our website. We also offer academic skills assessment. We call that ASAP. I have a wonderful colleague, Dr. Tab Shamsi, and he runs that. And it would just be a student emailing him to get on his schedule. It's just a assessment appointment and then follow-up appointments to help with things like motivation, procrastination, if you're having just any kind of difficulties around academics. And like I already said, we have case managers, two wonderful case managers who help students navigate kind of things if they want to go to the community. Insurance is such a tricky thing. They will sit down with you, walk you through your insurance, find referrals that work for you. It's a really supportive process. And then I think on the next slide, I talk more about timely care, or I do. Yes, okay. So timely care is also a wonderful service. I'd say if you're a student on this webinar, you might want to go ahead and download it now. It is like kind of a company that we partner with. A lot of universities partner with Timely Care, and it's an app on your phone that allows you to access mental health services. You can have 12 kind of free virtual therapy appointments with a therapist. They have a feature Talk Now, which allows you in the moment to talk to a therapist on phone or video if you're feeling any distress or just need support in the moment. They have psychiatric services, health coaching, a lot of different support services for students. So it's a great app to download. The thing I really love about Timely Care is that it's available to students in all US states. So say you end up going back home to Iowa for the summer and want to continue therapy, that's a great service. You can kind of connect over your time when you're not here in Illinois. And then accessing psychiatric services. So I know this is always just an important point for students coming here. If you are interested in psychiatric services or looking to continue your medication, I would say once you get to Illinois, you want to go ahead and make an appointment with us as soon as possible. And like I said, it's that IC appointment, initial consultation. Call us, go online and web book it, because you have to meet with a therapist, and that therapist will refer you to one of our psychiatric in-house. So you just want to make sure you get that first appointment on the book so we can get you in with a psychiatrist as soon as possible. I say sometimes like our biggest wait time is usually in the fall because we just have a lot of students coming in, but we have several options. So we always make sure that a student, is supported around their medication things if needed. We try to say if you can bring 3 months supply of medication with you so you have a little bit of buffer. And then if you're, interested in continuing your start of medication, please know when you meet with a psychiatrist, they do a full assessment and recommendations to meet with you. It's really supportive, and our psychiatric team does ongoing care. And again, those services are confidential and no cost to students to see a psychiatrist here, psychiatric prescriber. And then additional services. We offer tons of great things, but I'll kind of highlight a few things. Let's talk. A lot of universities offer this. It's an anonymous drop-in therapy session anywhere around campus. So a student can go and see like, oh, wow, they're doing that Thursday at Booth, and just walk over to Booth, which is the business school, and meet with a therapist totally anonymously. You don't have to share name, any information. We usually find it's kind of like the gateway to therapy, maybe a soft start if a student's kind of curious. And we offer that kind of throughout campus during the week, and that will be on our website. We offer a lot of support spaces, community programs. One that I'll just highlight is our Open Art Studio. We offer that every other week, where we have two of our providers who do just art projects, and all students are welcome to come and kind of have a few hours doing an art activity with peers, and it's really relaxing and enjoyable. We do tons of outreach for students on campus, and then therapy services and groups, which I already gushed about, so I won't do that again for you. And then we're available to students 24/7. We have our therapist on call, which is the number there. During the day, evening, afternoon, you can always call that number and get support. We also have a provider, Yael Hoffman, who is our crisis care counselor, who's in an office, and her job is really just to be here when a student walks in. So if a student's ever having a hard time, they can walk in Monday through Friday, 8:30 to 5, and just say they want to see the crisis counselor, and she's available to offer you support, kind of whatever your concern is. Additionally, we have our Timely Care, the app I also shared. You can log into that app and use Talk Now. And that is just a confidential support space virtually or on the phone to talk to a counselor if you're feeling any distress. Here's some other supportive numbers that I hope you never have to use, but I think it's always good to know about: our police department and emergency services. If you ever need it, those are also available to you.
Great, thank you. So I'll just briefly touch on some of our health promotion offerings at UChicago Student Wellness. So we really focus on, we do a lot of outreach as well with both the medical and mental health teams. We do education programs. We focus on research to make sure we understand what students at UChicago are really needing from us. We work with students on a regular basis. We actually have student workers that go out into the community and talk to other students. We do a variety of surveys, et cetera. So we really focus on understanding the student need, bringing that information back to student wellness, and also developing programs and services to make sure we're doing exactly what you need us and want us to do. A few of the programs that we offer, so we do have mindfulness and meditation courses. We have something called Maroon Mental Health Matters, which really trains students, staff, and faculty how to recognize signs and symptoms of someone in mental distress, and just how to help them out and get them into the right hands. We offer a variety of programs on sleep. We have alcohol and other drug programming. We do have a student recovery group that meets every week, and that is peer-to-peer. Um, we have a ton of safer sex supplies that are available to students in the dorms and all across campus. And then we do a variety of large scale events. So I would say our flagship event is this fall. It's called Wellapalooza, and we have a lot of really fun activities. We have um, inflatable slides and like a balloon twister dude, and different snacks and treats, but we also have a lot of our campus partners there telling you about all the things that they do that also relate to student well-being. So it's a great way to learn more about what is offered across campus, but also have fun and get to know some of your peers a little bit more. As mentioned, we do also work really closely with students. So we have different student groups. We have an advisory board that we meet with once a month. So if there are things that you're interested in or ways that you would like to get involved with student wellness, you can always reach out to us and ask about opportunities.
All right. Health insurance. So, um, although student wellness doesn't actually utilize insurance because, again, like was mentioned, the services that you receive at student wellness are free to you, but you do still need to have insurance. So the university requires that all registered students carry adequate health insurance. So in order to ensure that you have adequate health insurance, you need to choose one of the following by October 16th. So this is your insurance deadline, October 16th. So option one is to waive the university student health insurance plan, which we call USHIP, and keep your existing coverage. But you do need to make sure that your existing coverage meets our comparable coverage guidelines. And there's a QR code on the screen there that tells you what are the guidelines for having comparable coverage. And if you do have insurance that meets our guidelines, then you can waive USHIP. And please note that you'll need to do that every year of enrollment at the university. The online waiver tool will be open in early August. So that's option one. Option two is to enroll in the plan that we provide called USHIP, University Student Health Insurance Plan. So that is a plan that's provided through United Healthcare Student Resources is the carrier, and it provides platinum rated coverage. So if you do need comparable, if you do not have comparable coverage and you need insurance, then you can enroll in USHIP. And again, that deadline for incoming students is October 16th. Please note that if you do not take action to waive by October 16, you will be automatically enrolled and billed for the University Student Health Insurance Plan. So please make sure that if you're planning to waive, that you do so before October 16. There's a lot of information on our student insurance website, studentinsurance.uchicago.edu, or you can just scan that QR code on the screen to review the comparable coverage checklist, to compare plans, or to enroll or waive coverage starting the first week of August. So that is the high-level overview of the health insurance requirement. And I will turn it back to Elizabeth.
Thanks, Celia. So I would say obviously there was a lot of information today. We're happy to stick around and answer questions, but one of the best ways to learn more is to get connected with us online. Instagram, if you have it, is a really great way to do that. We often post about upcoming therapy group openings, events that we're doing, our Art Open Studio, insurance dates, when we have different flu clinics. So Instagram is a really great way to stay connected. Also, our events calendar. Our weekly wellness newsletter not only lets you know about what we're doing, but also what folks across campus are doing, what things are going on in the world. And so that's a great way to stay up to date and involved as well. It comes every Monday morning in your inbox. We try to make it as entertaining as possible. So please feel free to sign up for that with the QR code today. Another really great way to just stay connected and up to date on what's going on. And then, of course, our website that we have mentioned a few times already. We try to keep that as up to date as possible as well. And then finally, this is just our contact information. Once again, if you didn't get it before, really great thing to save in your phone so that you have it in case you need us. We are here again, Monday to Friday, 8 to 5. But we have a lot of after hours options for you to reach out to us and contact us as well. The QR code on this page is actually goes to a form that goes to our internal team. So if you have questions outside of today that you don't get a chance to ask in the Q&A, you can always submit questions via that form, and our team will get those and reach out to you as soon as possible. So happy to open it up to Q&A now if folks want to ask questions. I see that there are two in the queue. I think they are both things that you can answer, Celia.
I'm working on it.
Okay,
I have been keeping track of some of them as well. So I have a few that I can throw at you all.
great.
Let's see. We have kind of a lot relating to immunizations and USHIP or like insurance stuff. So we'll start with those. Questions about immunizations. Can students get the required immunizations on campus? Or I guess if they can't get a certain vaccine in their country, and that they have to be here for it, like what does that process look like, or how do they go about doing that?
Yeah, so we understand that some of the vaccines are not available in all countries. So when you get to campus, we encourage you to go to a local pharmacy as soon as possible upon arrival to get any vaccines that you still need. You will need to show proof of insurance so that you don't have to pay anything out of pocket for those vaccines. And then once you get those vaccines, the pharmacy will give you proof of vaccination, and then you'll upload that into your wellness portal to make sure that you meet all those compliances. So yes, you can do it upon arrival to campus. Just try to do it before October 2nd.
Awesome. Thanks. A couple more related to that, about maybe people who are coming for like a summer session or September term, when those immunization records would be due, and if they submit them for one of those terms, do they need to like resubmit for the fall quarter?
Yeah, so if your academic program starts after the summer immunization deadline, which is this Friday, July 10th. So if your program starts after July 10th, then you're going to be part of the group that needs to submit proof of immunity by October 2nd. What was the other question?
If they'll need to, oh, maybe that was them. When
Okay.
yeah, when are the, or yeah, if they were due, yeah, I think you answered both
Okay.
parts.
So again, your academic program starts after July 10th, then you will be part of the group that needs to comply by October 2nd for the immunization requirement.
Perfect. Yeah, that answers it. Because the other part was just, do they need to resubmit for like autumn quarter? But that is the same deadline. So
Right.
Okay, a couple of insurance questions now. First one being, if a student arrives on campus before autumn quarter begins, can they utilize UShip or like student wellness services?
I believe that students can start making appointments at Student Wellness starting the first week of August. Now, you can go ahead and start to upload your immunizations now, but as far as making appointments at Student Wellness, that will be open to you starting the first week of August. Regarding student insurance, so UShip, that coverage does begin September 1st. However, if you need insurance in the month of August, like if you're coming to campus early for like sports or whatever, um, we do provide early arrival coverage on UShip just for the month of August. You pay premium directly to United Healthcare. It doesn't filter through your student account. But if you go to our student insurance website, which was posted, hopefully you have that, um, and scroll down, you'll see a label for early arrivals, and that gives you more information on the August early arrival coverage.
Great, thank you. Um, can you maintain your existing insurance and also enroll in UShip? Are there any complications with being doubly insured?
You can have multiple insurances at the same time, but it's just important for you to know that UShip always pays as primary. So your claims are going to first go through your UShip policy. And then if anything is denied on UShip for whatever reason, although UShip has really good coverage, but if anything's denied, then you can take that claim and ask your provider to submit it to your second insurance. So you can have two insurances at the same time is the short answer to that question.
Great. Um, where did it just go? Okay. Does UShip cover dental and or vision? And if not, how do most students secure those services?
Okay, that's a great question. So UShip only provides pediatric. So if you're under 18, you can have pediatric coverage on UShip for vision and dental. Otherwise, we do have several plans that we've negotiated with carriers for optional vision and dental coverage. And you will actually purchase those directly with those carriers if you're interested. We have that information on our website, our student insurance website, but those plans will not be available until September 1st. However, you can start to enroll in those plans as early as the first week of August. So yes, we do have optional vision and dental. Again, you will enroll directly with the carriers. It doesn't go through your student account.
Great, thank you. Here's a question kind of about clarification on immunization records. The wellness website says new students for autumn quarter 2026 will be able to upload proof of immunizations to their wellness portal starting the first week of August. So they just want to confirm if they can start uploading them now or if they need to wait until August.
Yeah, it's tricky because different academic programs have different timelines, but incoming students for the college, you should be able to upload your proof of immunizations now. A lot of the grad students can't do that until the first week of August. So that's why we put that up there. But you, as incoming college students, should be able to do it now.
Perfect. This, at least for the moment, might be the last like UShip question, and then we'll like shift to some other questions. What is the benefit, if any, of enrolling in UShip over your existing insurance?
Well, hmm, I guess you just want to make sure that you have good coverage for, the time that you're residing in Chicago, because not all insurance plans will cover routine services, just like, x-rays, MRIs, lab work. Some insurances won't cover that if you have purchased that insurance in a different state. So it's really important to make sure that you use our comparable coverage checklist and compare your current insurance with what's on that checklist. And if there's anything that falls short, then your insurance would be deemed not comparable. And when you fill out the waiver form, it would be denied. So it's just important to review your policy, your current policy. If you have questions about whether your current insurance meets our requirements, we encourage you to share our checklist with your current insurance plan administrator, and they can help you figure out whether your current coverage meets our requirements. So feel free to share that checklist with your current insurance companies.
Great. Um, okay, here another. Okay, these questions are kind of more about like medical services and accessing those. Um, this one is kind of confirming eligibility or like if they're free or not. It was said student health is free and then free for eligible students. Which is it?
So I'm sorry, Elizabeth, go ahead.
Go ahead.
It's free for eligible students, but the care and they have to meet, Elizabeth, if I'm not mistaken, it has to, there's certain programs that they have to be enrolled in to be able to receive services here. But the
Yeah,
care that they receive here is free.
Yeah.
generally, if you're a full-time student at the university and
Mhm.
you're studying at the Hyde Park campus, then you're considered eligible. That's kind of the general rule of thumb.
Great. Um, this question is for students with medical conditions. How can they go about transferring their medical records to UChicago?
So they can certainly go into the portal and fill out a release of information, or they can contact their provider that they have and fill out a release of information. Those records will be sent here.
Great. Also kind of similarly to medical records, any like existing prescription medications, anything else like specific or different they should do to get those transferred?
So like if they're receiving prescriptions at a different pharmacy, like out of state.
Yeah, like if they are on a medication now and then like they're coming to Chicago and they need to move it to a pharmacy nearby or to be able to get it through closer to campus, if there's anything specific they should do.
Gotcha. If they're on already medication that they're taking and the um, pharmacy is outside of our area, they can contact their pharmacy and get it transferred to a pharmacy that's near us so they can continue their medication. If they're worried about like continuity of care, like getting care here on campus, for any medications or ongoing medical conditions, they can make an appointment with us and we can refer them, if need be, to a specialist at the medical center so they can continue with their specialty care.
Great, thank you. Um, looks like we maybe have a couple of like pretty specific questions that were asked. If one of you wants to look, specifically the one with the transfer student who was recently admitted. But this other question, is there specific meningitis vaccine required? They recently discovered one of their other kids had a different type than what is college required.
Not the vaccine expert. Celia, I don't know.
Yeah.
You know.
Let me see if I can get an answer to that. Hold on just a second.
Great.
Maybe go on,
Well,
go on to another one and I'll see if I can get an answer.
yeah, for sure. Um, This one was answered in the chat, but I'll just like mention out loud because it's a fun thing for maybe students to hear. Um, in our wellness online module, there's mention of like dog therapy that happens every once in a while. Um, can you tell us a little more about what that is and how often that happens?
Yeah, so we have a program called Pet Love where we bring in therapy dogs. That's usually just once a quarter, typically either during finals week or right before, for several hours. This year we hosted it at the library most of the time, but it's sort of in different locations across campus. But another reason why you should follow us on Instagram and get our newsletter so you know when these things are happening.
If I was to vote, we would have a dog here in the Wellness Center for staff and students.
I wish. I wish. Karina, there's a
Same.
question about refilling hormone prescriptions and wondering if they need to contact our psychiatric care. Can you answer that question?
Yeah, I feel like for that, it wouldn't go through psychiatry. That would be on the medical side. You
Yep.
can make an appointment to continue that through student wellness on the medical side, but you wouldn't
Yep.
need to see psychiatry for that at all.
And our providers here, some of them do, give bridge prescriptions or, assist students if they're on like a continuing stable medication. They will continue to prescribe that. Otherwise, they will give you a referral to seek someone outside the wellness center over at the medical center.
And I just wanted to respond to the question about the transfer student who's needing the deadline to drop UShip. We have on our website the number to UShip reps. They're in the office right now. I would really recommend calling them. They could give you the most accurate information to that, and they're available in office 8:30 to 5 Monday through Friday. So I would just call them directly if you can.
So the immunization form lists the meningococcal conjugate as the requirement for that particular proof of immunity. If you need more detailed information than that, I would recommend that you actually send an email to studentwellness@uchicago.edu, and we'll see if we can get you connected to the experts on that.
Awesome. Another question about prescriptions from an international student. So they'll be bringing an adequate supply from overseas, but in case she runs out while she's here, what would she need to do to obtain more? Does she need to see a doctor first to get a prescription, or is there another process for refilling prescriptions from overseas?
Yeah, so if she's on a medication and she's stable and she has enough medications, I would recommend that she go ahead and make an appointment with us preemptively. Um, because, if we have to, let's say, get a prior authorization for the medication, it might take a little bit longer. So once she comes to campus, go ahead and make an appointment to see a provider just to kind of discuss what prescription medication she's on and just to kind of get a little bit of a background. So this way, in case anything does arise, she's low on medications, anything like that, it won't be a surprise. There won't be a waiting period. She'll be able to get the same medications or comparable medications while she's here.
Great, thank you. I'll give it a couple more minutes to see if we have any other questions come through. But while we're giving that a second, I would ask all of you, like, what's one piece of advice or a tip that you have that you want to share with our incoming students?
I have one. If your student isn't going to get UShip and they are on a plan that's outside of Illinois, please let your insurance company know that your student is coming to University of Chicago and may need care here. So this way, if there's any emergencies that arise, we'll be able to kind of help them get connected and there won't be any issues with insurance, which sometimes we do get if the student has an out-of-state Medicaid.
Um, my piece of advice would be to try to prioritize sleep. Sleep is very, very, very important. It can be really hard to prioritize it, but it helps a lot, I promise.
On the mental health side, I would say it's so exciting. You're coming here. I know it's an awesome next chapter, but to know it is transitions are hard. It is absolutely normal and healthy to be nervous coming here, for you to feel uncomfortable or overwhelmed while you're adjusting here. It takes time to figure everything out, make friends, and just know that is a normal and healthy process for it not to feel so exciting and enjoyable all the time. It's hard to adjust to new things. And as someone who is from Chicago, I would say pizza's amazing here, and try to eat as much pizza as you possibly can while you're here. There's so many different types and all different awesome neighborhoods. So try to eat pizza everywhere you can.
I would say pay attention to those deadlines because I don't want you to get stuck. So please remember immunization deadline, October 2nd. UShip enrollment waiver needs to be submitted by October 16. And then also just a little plug for our open house. During move-in week, we have an open house at the end of the day on Tuesday of move-in week. So please come by and say hi, see our lovely facility, and you can meet some of us in person.
Great. Thank you all for sharing. That is very good advice and tips. Looks like we didn't have any more questions, so we will go ahead and wrap this up. Thank you to all of our presenters for sharing this information and answering some questions. And thank you to everybody who joined us today. Just as a reminder, this is being recorded, so you can go back and rewatch this later if you want like a refresher, or if you just want to like watch it again to refresh your memory. It will be posted on our website, probably by the end of the week for sure. It'll be up there so you can find it there. And as always, if you have any questions, please feel free to contact our office, college programming at uchicago.edu, and we will either answer your question or get you pointed in the right direction for an answer. And have a good rest of your day.
Thank you.
Bye, everybody.
Good
Bye.
luck.